Hi, I'm Cheryl Pederzoli, Marketing Leader at AGS Health. Today I'm joined by Emily Bonham, Senior Vice President of Product Management, here to talk about analytics and reporting. Emily, could you paint a picture of the difference between basic analytics and advanced analytics, especially in the context of healthcare revenue cycle management?
Sure. So we have a lot of our customers who come to us and say, hey, I can do basic reporting, but we really need to get to the next level. And what they generally mean is that they're either drawing reports out of their electronic health record system, which is not always, primed and ready to get true insights from the revenue cycle. So they're just not getting deep. They're getting reports on like how much work was done. They're getting information after the fact. They're not really able to ask questions about the data, and they're not able to really predict anything. So while it's a nice starting point, having an Excel file or something that they're sort of drawing directly from their EHR, it's not giving them those deep insights, and it's not allowing them to sort of compete in the market that they're in today, because they may have some peers that are doing things that are a little bit more complicated, yes, but also much more insightful. So that's where we can come in and really help our clients. For example, we've helped clients with more kind of like predictive analytics. We're actually able to look at like denial rates, for example, and say, okay, we see that you have denial rates that have been, right in this sort of threshold in this level for the last year. That means we believe that you'll be here next year. Or, oh, by the way, we're noticing that your denial rates for one payer is way off the charts. Is there something going on there? And we're actually able to help them pinpoint issues, sometimes with alerts, sometimes with sort of some look backs, and really just kind of predict what could happen next. So while basic reports are great, and some clients, they may not even be at the basic level. So if you are getting those basic reports, you're definitely getting something. But to get predictive, there's so much more out there that our clients can take advantage of.
Are there some common pitfalls or mistakes you see healthcare organizations make over and over that you've got some suggestions on how to avoid?
Yeah, so there's a number of issues that they run into. I see, particularly in the rev cycle, the cycle is long. You've got, before the patient comes into the visit, you've got the visit itself, and then you have after the visit, and there's all sorts of parties and players. There's physicians and payers and patients, and all the things that can happen. Then you end up with a coder and an AR agent, for example. So sometimes those are siloed in some organizations. So you may have a coding manager that never talks much to the AR department, for example. And so they're not getting a full picture of things that could potentially happen at the beginning of the revenue cycle, or perhaps before something is coded and sent off to the payer that could really help with denials down the road. Prior authorizations, for example, you can learn from those and make them better. But if you don't have patient access talking to AR, sometimes you're just sort of missing the boat. So that's one thing, is just seeing these silos. How can you look at that? And how I think analytics is a great way for someone that is in charge of the holistic rev cycle to kind of bring these silos together to help them work together on making things better. Technology programs as well. So sort of linking together technology programs, having interoperability with the EHR. So if you need to, get in front of a physician, you can do that before something ends up being denied by a payer down the line, and then a bill doesn't get paid, for example. So that, I think, silos to me is one of the biggest pitfalls that I see in some of the rev cycle today.
What role does data visualization play in making complex RCM analytics accessible and actionable about different departments and stakeholders within a healthcare organization?
Yeah, so this is really just human nature, that we tend to be drawn to pictures more than we are like vast quantities of data. I know I'm not a computer. I can't look at a big spreadsheet of data and make sense of it. Maybe if I've been doing the job forever and ever, I can start to pinpoint stuff, but I shouldn't have to. Like, my brain should be thinking about things that are, frankly, more important than sort of like going through and sort of shooting around, okay, this is here, this is there. So being able to just look at a chart or look at a graph, or even I like even better is that someone can start at one point, and they can kind of look at a data visualization and say, you know what, I really want more information. And instead of it all being presented at once, they can ask for it. So they click on it, it goes, can go into the next level, and they can really, the end user can really drill into those data visualizations to get more. So you don't need to give them all of it at the beginning. You let them sort of make those choices. Maybe they just want something high level, or maybe they're writing a big report for their, for a board member and they want to get really deep. So I think you need to be able to know your audience and know that your audience is going to prefer something visual and something high level that they can then make sense of as they need to.
Are there any trends or innovations that are coming in data analytics, measurement, or reporting that you think are going to impact healthcare organizations' revenue cycle in the next couple of years?
Absolutely, and I've been in healthcare RCM. I've been in data analytics, and for many years. And I've been through the whole query builder age, where it was everybody said they had a query builder, and it was supposed to allow end users to be able to build queries, to come up with these insights, and it was going to change the world. And it didn't. And really what I think is going to change the world is using natural language, and we see that now in AI, right? So in AI, you can say, hey, I really would like to see something. I want to see my denial rates for the last year. I want to see what payer is the top, and I want to see which ones of my AR agents have tried to mitigate that problem. And get all of this information. I mean, you can imagine that would be coming from so many different reports, so many, potentially different databases. There could be, data coming from everywhere. But it really is like a simple language ask. So you would ask that to your analytics system. You'd say it in natural language, and then you would get your report back. And I think that's what's really going to transform the industry, is that the system will understand. You won't have to sit there as an end user and build a query. You won't have to figure out how to do that and read a user manual, but you'll just be able to say it. The system will understand it, and you will get what you need. I think that will transform the industry, and I think we're getting there. I think we're getting very close. I've seen prototypes of these types of systems in sort of other areas, and RCM is, quickly, getting into this, where I think it's going to be pretty amazing. So,
Emily, what are your thoughts on applying gamification to help drive data-driven insights and decision-making in the revenue cycle?
Yeah, so this is something that we're actually working on right now quite a bit with our AR associates. There are different ways that we are looking to improve their morale and make their job more fun. I mean, no one says, I want to be an AR agent. I want to, look in an EHR and try to figure out what claims need to be paid, and then I need to go call an insurance company and see what's happening and go through all of those steps. So how can we make that more fun? How can we make it more rewarding? And I think it goes back again to what I've talked about in the past, which is the human aspect, sort of thinking, what intrinsically motivates people? And what motivates them are, did I do a good job? We actually, we interviewed and did a survey with our AR associates that do AR work at AGS Health, and we said, what motivates you? What sort of, do you like at work? And honestly, the biggest thing for the majority of the people that we interviewed was, I want to know if I'm doing a good job. I want to know how I stack up. I want to see how my peers are doing. And so gamification can show you that. It can say, you can have leaderboards, you can make it more subtle, where you say, hey, yesterday you completed, you were able to, recognize a certain amount of revenue, and today you're at this point, and you sort of help them track it along. So you can be, really in your face about it, where you're awarding people awards for meeting certain targets of KPIs that are sort of chosen by the leadership of the operational team, or you can have them kind of pick and choose what kind of badges they want to go after in a day. And it's really fun. We all really enjoy kind of seeing how we're doing, even whether it's against ourselves, trying to do better every single day, whether it's, you're comparing yourself against others. You could even have trending like, hey, AGS agent against an agent at one of our competitors. And you can make it really fun. You can make it team oriented. We also realize that our teammates really like being part of an operational team. They like having teammates. They like creating a team identity. And you can do all of that with gamification. So we're trying a number of different tactics within some of our software to sort of try things out and see how it works. But we're convinced after looking at the data, talking to companies like AWS who have different features and functions within their organizations, and kind of seeing what works best for us.
For healthcare leaders that are looking to really foster a data-driven environment in their organization, is there any advice you would offer to encourage and ensure effective adoption?
Yeah, I think you really have to understand it again from sort of the human perspective. So you have to understand that people aren't going to do things that they don't understand why they're doing it. They don't know why it matters, and it doesn't help them. Okay, so if you're just like, you need to look at this report every day, and they don't see any reason why to do it, then of course I'm building these reports and no one is looking at them. Well, let's go back and look at what the end user wants, and what the end user wants is to understand why. Why do I need to look at this? Oh, maybe I'm getting an alert from the report. Maybe the report is alerting me that maybe I'm a team leader, and it's alerting me that one of my operations teams is not, producing the way they should. There's something off in their metrics. They're not meeting their KPIs. Now that's interesting, right? So you really have to look at it in that way. And if you're just providing people with reports and saying you need to use these, you're not going to get what you want. So you really have to understand, how does this help the user, and do they understand why? There could also be incentives. We've done some things at AGS where we've actually exposed to teams around certain productivity reports, and we've said, hey, we noticed that this pilot team that we rolled this out to now has an increase in productivity because they're looking at this report. And then we go to the next team as we roll it out and we say, look what this other team did. And so it's almost like you're creating a little competition. You're sort of, relating that to their human needs. And by doing that, then, you're increasing their data literacy, you're increasing their need to use it, and you're making your product sticky. I think it's important to make your product sticky, whether it's an internal product like a report, or it's Facebook trying to get you to come back and use their software, 20 years later. So.
Well, I want to thank you for sitting and talking with me today and talking to us about analytics and what's coming down the line and what you can do with it. So thank you very much.
Thank you, Cheryl.